Wednesday, July 14. This is the news on PBCJ. I'm Gabrielle Thompson. The Ministry of Health and Wellness launched its Jamaica Salt Consumption Knowledge, Attitude and Practices Study, or SALT CAP study, on Tuesday. The University of the West Indies and the National Health Fund will be working with the Health Ministry to complete the research. The findings will be used to establish programs in an effort to meet the World Health Organization's recommendations of less than 5 grams of salt per day for adults. Melvin Pennant has that story.
Overconsumption of salt or sodium contribute to high blood pressure, stroke, heart and kidney disease. Director of the Health Protection Branch at the Health Ministry, Dr. Simone Spence, says high blood pressure affects 1 in 3 Jamaicans and another third is pre-hypertensive.
1 in 10 Jamaicans consume excess salt by adding salt at the table or frequent consumption of salty sauces or high sodium processed foods. The problem is not just salt added to food during cooking or at the table. A significant amount of sodium comes from ready-made meals and prepared foods, including processed meats, breakfast cereals, and snack foods. As a part of the NCD agenda, the ministry has undertaken several initiatives to focus the population on adopting a healthy lifestyle and taking proactive steps to improving their health.
Dr. Spence says an important aspect of addressing health issues in a population is through research.
This study, therefore, will help to determine the knowledge, attitude, and practices of our population as it relates to salt intake and strengthen the implementation of strategies to reduce sodium intake. Given that the entire population is at risk of NCDs, given the significant impact and the burden of NCDs, it's imperative that there is sustained action to mitigate the effects of salt consumption.
For his part, Minister of Health and Wellness, Dr. Christopher Tufton, notes that the study is part of the ministry's efforts to inform consumers on healthy lifestyle choices.
1.4 billion Jamaican dollars goes to support Jamaicans with hypertension. And that's a big amount. What if we got Jamaicans to change their lifestyle and so not needing that kind of payout? Then the NHF would be more viable for starters. We probably would pay less taxes to secure our own health treatment. And of course, the longevity and quality of life would be enhanced. This, to my mind, is the substance of the argument today, why studies of this sort are necessary and why we cannot pull back from our advocacy around nudging Jamaicans to improving lifestyle, because frankly speaking, it acts in their best interests.
During the study, researchers will observe spot urine analysis, sodium content in packaged foods, and salt content of food sold in restaurants. In addition, there will be a national survey of 1,200 participants to evaluate knowledge about salt intake and health. Melvin Pennant, PBCJ News.
The government plans to increase the number of restorative justice centers across Jamaica. Justice Minister Delroy Chuck says plans are in place to establish one facility in Marvelly St. Andrew Northwestern and another in the constituency of St. Andrew Southwestern. He made the announcement while speaking at the virtual launch of the Restorative Justice Facilitator Training Program on Monday. Justice centers, which have been established in every parish, are equipped to handle matters related to child diversion and restorative justice, as well as dispute resolution, among other justice-related issues. Minister Chuck encouraged the 103 persons who will be trained as restorative justice facilitators over a 2-week period to use the information to make a difference in their communities. The Sexual Harassment Protection and Prevention Act 2021 has been passed by the lower house. The legislation is expected to mark a major cultural shift in the country, with workplaces, schools and other institutions mandated to curate the legislation into policy. We get more from Simone Absalom Gale.
Minister of Culture, Gender, Entertainment and Sport, Olivia Grange, says when the bill becomes law, it will deal a blow to sexual harassment by bringing relief to victims and punishment to perpetrators, while acting as a deterrent to others.
Last week, I brought to our consciousness some of the improvements in the bill to include the fit and proper person criteria. the institution of a sexual harassment policy statement within 12 months, the widening of the categories that can be sexually harassed, the limitation of action, and the review period of 18 months.
The minister also notes that the legislation is gender neutral because both men and women are susceptible to sexual harassment. Under the new law, victims of workplace harassment can make complaints directly to a tribunal to guard against undue prejudice.
It is important to note, Madam Speaker, that Clause 27(4) of the bill mandates the use of internal complaint mechanisms before a matter progresses to tribunal stage. However, Clause 7 overrides the proviso in 27(4) to protect a potential complainant. Many complainants have often expressed fear where sexual harassment is meted out to them by their supervisor. The requirement to use internal mechanisms as a first point of complaint would undoubtedly greatly expose such a person to undue prejudice. It is this situation which Clause 7 seeks to prevent. Thus, where an allegation of sexual harassment directly involves an employer or the person in charge of an institution, such a complaint should be made directly to the tribunal in keeping with the tribunal's processes and procedures.
The tribunal will also consider complaints from tenants who are being sexually harassed by their landlords. Other instances of sexual harassment are also covered. Member of Parliament for Manchester North West says the bill has the support of the opposition, but he says an appropriate legislative remedy should be considered to protect victims from unintended consequences that may arise from filing a sexual harassment claim.
In the Joint Select Committee report, there was a proposal to create a standalone victimization provision that can be advanced through the tribunal. This would empower the tribunal to make a financial award for such a breach or authorize the parish court to award the victim. However, I note in reading the report that the Joint Select Committee did not accept this suggestion. I am therefore recommending that a clause be inserted to give effect to this recommendation, as we must do everything in our power to protect victims from sexual harassment.
Justice Minister Delroy Chuck also gave his support.
We must send a signal in this sexual harassment bill that we need to treat our women properly and appropriately at every sphere of life. And Madam Speaker, I hope that a few cases will come to the tribunal, and hopefully when they are assessed, it can send the right signal in terms of how we balance. Because in truth, Madam Speaker, we need to balance carefully and appropriately. Because yes, Madam Speaker, I have no doubt that there's a fair amount of sexual harassment at the workplace when tenants need to get places for accommodation. Landlords utilize their power and the knowledge that they have somewhere for the tenant to get and abuse the women, sexually abuse the women who need these places for accommodation. We get the sexual harassment, Madam Speaker, in many institutions. And this bill, Madam Speaker, must send a signal that these harassment must stop.
The bill, which was passed with 10 amendments, will now be debated in the Senate for its approval before it is enacted into law. For the news on PBCJ, I'm Simone Absalom Gale.
In today's business report, the central bank cautions the investing public on cryptocurrencies. This plus our regular market updates. The Bank of Jamaica is reminding the public of the potential risks of using or investing in cryptocurrencies. Cryptocurrencies are digital currencies that are not issued or guaranteed by a central bank or a monetary authority. In addition, cryptocurrencies are not legal tender in Jamaica, meaning the central bank does not regulate or supervise these forms of digital currencies. In that context, the BOJ is cautioning the public to be aware of the various risks associated with the use of cryptocurrencies, including high volatility, causing significant fluctuation in value, the use of cryptocurrencies in the conduct of criminal activities, including money laundering and the financing of terrorism, a higher degree of cyber fraud and hacking, and settlement risks that may arise as this currency is not issued or backed by the central bank or other monetary authorities. The BOJ says the public should be mindful that individuals engaged in the use of cryptocurrencies are doing so at their own risk and are urged to conduct appropriate due diligence. In Tuesday's trading session, the JSE Combined Index declined by 6,934 points to close at over 424,000 units. Overall market activity resulted from trading in 95 stocks, of which 28 advanced, 41 declined, and 26 traded firm. The Junior Market Index advanced by 7 points to close at over 3,000 units. Stocks advanced for 138 Student Living Jamaica, Caribbean Cement Company Limited, and Consolidated Breakers Jamaica Limited. Stocks declined for AMG Packaging and Paper Company Limited, Barita Investments Limited, and Berger Paints Jamaica Limited. Trading firm were 1834 Investments Limited, Caribbean Flavors and Fragrances Limited, and Siboney Group Limited. Trans-Jamaican Highway Limited was the volume leader with over 1.9 million units, followed by Sagicor Select Funds Limited Financial with over 700,000 units, and Future Energy Source Company Limited Ordinary Shares with over 700,000 units. In foreign exchange trading for Tuesday, July 13, the US dollar sold for an average $154.74. The Canadian dollar ended trading at $123.86. The pound sterling traded for $212.39, and the euro sold for an average $184.71. In market data for oil, prices dropped on Wednesday after Reuters reported that Saudi Arabia and the United Arab Emirates had reached a compromise over a global supply deal that will allow the UAE to boost its output. Brent crude futures lost 0.16 points to settle at $76.33 a barrel. West Texas Intermediate crude slid 0.34 points to settle at $74.91 a barrel. What does servicing your car have in common with maintaining a healthy smile? More than you realize. In today's Living Healthy, one of the hygienists at EBINI Family Dental, Andrew Tate, explains it all.
Hi, I'm Andrew, one of the registered dental hygienists at EBINI Family Dental, and today we're going to be talking about alluring smiles. Hey Doc, how you doing?
Hey Andrew, how you doing?
I'm good, I'm good. You know, I saw a car just like yours in the traffic this morning, smoking like crazy.
Smoking? But
Yeah.
you know that couldn't be me. Because Mr. Fenton calls me for servicing like clockwork.
Yeah.
I don't even have to worry about that.
Yeah, I figured it wasn't you, because right off Old Hope Road it turned off, so I figured it maybe somebody else.
Yeah. So you have a lot of patients today?
Why, Doc? My hands are full.
All right.
So according to the American Dental Association, it is very important that we brush every morning and every night for at least 3 minutes. Not only when we're brushing, we should focus on the teeth, but also the tongue. At least 10 strokes will help to remove the bacteria that accumulates on the tongue, which facilitates bad breath. So cleaning the tongue daily helps to facilitate a more fresh breath. Another factor that we take for granted is that when we brush our teeth blindly, meaning we try to clean areas of the mouth that we can't see visibly. Secondly, we also try to brush our teeth when we're either rushed distracted, or let me say a bit tired. As a hygienist, it's our professional duty to clean the areas that you're not cleaning properly. Hygienists are professionals that helps us to clean the areas that we're missing, as well as to teach us how to clean them properly. How often hygienists see our patients depends on how well the patient routinely manages their hygiene. As in, if you have somebody who manages really well, seeing them every 6 months is pretty sufficient. However, in more advanced cases, like patients who are unable to manage their gum disease, or patients with advanced implants or other treatments, might need to come in to see us a little bit more often, like every 3 months. Certain medications like diuretics, painkillers, antidepressants, they reduce the salivary flow. One of the important factors of the saliva is to help to rinse off the tooth surface, as well as to control the bacterial flora of your mouth. This helps to prevent microbial invasion, which then leads to dental disease. Studies also suggest that the oral bacteria and the inflammation associated with periodontitis, which is a severe form of gum disease, may play a role in certain diseases. In addition, certain diseases like diabetes and HIV/AIDS can lower the body's resistance to certain infections, making it more of an issue for your body to fight off the disease. So as you can see, it's just as important to maintaining the miles in your smiles as it is to servicing and maintaining your car. For more info, check us out on Facebook, YouTube, or our website.
We now go to news from across the region. In Trinidad and Tobago, Prime Minister Dr. Keith Rowley received his first dose of the Sinopharm COVID-19 vaccine at the Diego Martin Health Center on Tuesday morning. And with the large shipment of vaccines that arrived in the country, Dr. Rowley is urging all to get inoculated as soon as possible. Sunil Lala of TTT News reports.
More than 3 months after testing positive for COVID-19, Prime Minister Dr. Keith Rowley received his first dose of the Sinopharm vaccine. In early April, Dr. Rowley tested positive for the virus and had to wait at least 6 months to be inoculated as per WHO's guidelines. But that 6-month stipulation was recently reduced to just 3 months for a recovered COVID-19 patient. And after being inoculated just after 10 a.m., Dr. Rowley urged the population to also get vaccinated, since he says it's the only way to get back to normal.
As I speak to you now, a large supply of vaccines are landing in the country. So for the next few weeks, we are going to have as many vaccines as we require to vaccinate persons who should come forward. It's a volunteer program, but that does not mean that because it is voluntary, you would decide that nobody is pushing me, so I wouldn't go and get vaccinated.
The Prime Minister adds that there is evidence that unvaccinated countries still cannot cope with the effects of COVID-19 and that deaths are being reduced by populations which are vaccinated.
Populations that are vaccinated are protected insofar as people are responding better to any infection. It is reducing the need for hospitalization. It is reducing the strength of the illness on you, and it is virtually eliminating deaths.
Meanwhile, Chief Medical Officer Dr. Roshan Parashram says the 800,000 vaccines which arrived in Trinidad and Tobago today will be available as early as Wednesday.
As you know, the health centers run by the RHAs throughout the country will be taking care of the vulnerable people in the first instance, which are those over 60, those with NCDs regardless of age, and healthcare workers in particular. So you can come out at any of the health centers.
Dr. Parashram adds that the ministry will also intensify vaccination at the mass vaccination sites in an attempt to use up the 800,000 vaccines in the shortest possible time. Sonolala, TTT News.
1 month before the state of emergency is set to expire in the Bahamas, the country's Ministry of Health says there have been no discussions about extending it beyond August 13. This as the Minister administration is in talks with COVAX for nearly 60,000 doses of the Pfizer COVID-19 vaccine. Jasmine Brown of Our News has the details.
Speaking to reporters outside Cabinet, the health minister says for now there are no plans to have the House of Assembly meet before September. And that means that for now there are no plans to extend the state of emergency.
The state of emergency ends on August 13th. If there's going to be any change to that, obviously the competent authority, the Cabinet of the Bahamas, would have to come back to the Bahamian people to say so. Right now there's no discussions about changing the fact that the emergency order ends on August 13th.
Wells says if anything changes, the government will come to the Bahamian people in the shortest possible time.
In order to be able to do that, I do believe under the law you would still have to go to the House of Assembly, and the House of Assembly doesn't meet until the 22nd of September. We would have to call an emergency session. The Governor General would have to call the House of Assembly back into session to be able to do that. But as it stands now, we're moving forward as we would have intimated in the past, which is the emergency orders ends on the 13th of August.
Government officials have repeatedly said the Bahamas' economic recovery is dependent on the willingness of Bahamians to get the COVID-19 vaccine. Wells says it is promising that more than 60,000 people have received at least one dose of the AstraZeneca vaccine. The third tranche of vaccines through the COVAX facility is expected to arrive later this month following weeks of delays. Wells said the government is also hoping to receive a tranche of Pfizer vaccines.
We have been offered some 57,330 doses of Pfizer through the COVAX facility. We will have a more definitive date when that vaccine will arrive, when Pfizer will arrive in country by Friday of this week.
The health minister was asked if the administration was considering vaccinating children as young as 12 years old.
Our kids are going back to school in September, and so obviously we need to be able to take that into consideration. And so that is one of the reasons why we sought to source Pfizer, because Pfizer is the only EUL approved vaccine for individuals under the age of 18.
Reporting for R News, I'm Jasmine Brown.
The Agriculture Ministry in Guyana will be taking steps to revamp the EBINI research station in the country's Region 10 as it continues plans to resuscitate and improve Guyana's agriculture sector through improved research and technology. Newsroom Guyana has the details in this report.
Though the EBINI research station in Region 10 boasts established orchids, a germplasm coconut plantation, and demonstration farms for crops like corn, over the years the station was unable to make an impact on the overall development of the agriculture sector. But the research station will soon see a fresh new face and renewed vision, as government plans to revamp it, as plans move ahead to improve Guyana's agriculture sector through improved research and technology. The Agriculture Minister, during a weekend visit to the station, told the media that it has not been conducting research to the scale that is required to boost the agriculture sector.
This station was supposed to be a station that we had to do research to ensure and get different species of animal we're here and also different crops. I understood just now from workers that they have been doing some of those research, but they are not doing it in a scale that we want it to be done, because as present this research station was supposed to ensure that we give the kind of leadership and guidance to farmers around the country. As we are now a country that is advancing the agri-food system in the Caribbean, this research station will have to refocus. As Minister, I will ensure that we do some rehabilitation work and some critical infrastructure. For example, the lab, the training room, the seed storage area, the other infrastructure like the water system and things like that. And we have to also look to refocus the entire station and how they will be functioning. As a matter of fact, it seems that different agencies, GLDA, NARI, NDIA, the Hydromet that have staff here, they have been doing their thing by themselves in terms of working directly under those agencies. What I intend to do is to have a coordinator, to appoint a coordinator here, and that coordinator will ensure that he coordinates with all the agencies, and then we'll refocus this agency.
On the bright side, cattle research being done by the Guyana Livestock Development Authority there has been making strides, the minister reported. This will be especially important as the ministry plans to ramp up the breeding program to ensure farmers have greater access to quality breeding animals.
there are a lot of interest in our cattle industry now, and we have to ensure that we focus and we start those program back, ramp up those program back, the breeding program, so that we can have cattle. And because as you know, in the Ministry of Agriculture objective, we have abattoirs across the country that we'll be building, and we'll need animals to slaughter at these facilities.
The EBINI research station is one of the oldest research entities in Guyana. It was established in the 1940s. The station initially started as a livestock research station, however the crop research station was established in the early mid-1960s. Over the years, the station has been responsible for the development of a number of crop and livestock farming systems applicable to the intermediate savannas. Reporting for the newsroom, I am Shakima Day.
In sports, we're out the blocks with athletics. Jamaica copped 67 medals at the recently concluded North American, Central American and Caribbean Under-18 and Under-23 championships in Costa Rica. Marlon Samuels tells us more.
A team from the Ministry of Culture, Gender, Entertainment and Sport, led by Olivia Grange, was at the Norman Manley International Airport to welcome home Jamaica's athletes from recently concluded 2021 North American, Central American and Caribbean Under-18 and Under-23 championships in Costa Rica. 19 territories competed in the games. Jamaica dominated the championship.
In the 400 meter, there's around 51.9, got the gold medal with a possible record. They've never announced it, but it was a record. And in the 4x400 meter mix, we won a gold as well, so 2 gold medals for me.
I performed very good in the 100, especially and also in the 200 with a new record of 20.74.
16-year-old Tina Clayton produced one of the most outstanding performances. Her 11.17 seconds in the 100 meters makes her the third fastest among under-20 athletes in 2021.
I have been training really hard. I was expecting to run level 1 from trials, but somehow it didn't happen. I am grateful that I achieved a big goal since I went to the knockout.
16-year-old Alania Reid ran 23.78 seconds to win gold in the 200 meters. She is the first woman under 18 years to break 24 seconds at the championships.
You did extremely well, and we are very, very proud of you. What you've shown is that you are the next generation that will make us extremely proud in the Olympics. I want you to stay focused. Anything that we can do for you to help you in your development, we will do that. You can depend on me, you can depend on the team at the ministry. And if you go on my Facebook page, you'll see my telephone number. So I'm as close or as near as a telephone. So anything at all, don't hesitate. Remember in life, there's no problem that cannot be solved. There's always a way. And I want you to get the best opportunity that is available to you in life, both in your personal development, your educational development, and your athletic development.
For the news on PBCJ, I am Marlon Samuels.
And that's our package. You have just watched the news on PBCJ, the People's Station.